Welcome to this video on COVID-19, workplace training and health education. My name is Josfrida Nyamvulangoa, an emergency and critical care clinician and a COVID-19 champion. The objective of this section is to demonstrate and understand how to provide health education and training specific to COVID-19 in the workplace. The COVID-19 scenario all around the globe has tremendously affected the world at work, and it is becoming more apparent that there is an emerging need to address the implications on occupational and environmental health. The intent of this section is to provide direction and advice to address the socio-economic disruption that COVID-19 has caused and to support the safe restart of economic activities in the country. While COVID-19 cases are still prevalent, a series of guiding principles would need to be strictly followed at the workplace to safeguard the health, well-being of the workers, their families, as well as restrict the transmission of this disease. It is recommended that each organization implements strict guidelines suitable for their workplace in the form of a possible return to work guide. Consider downscaling of non-essential services so as to maintain both safe and well thought out initiation of economic activities and to safeguard the workers and the public. Exercise cumulative social responsibility, both employer and the employees, to reliably implement and maintain for an effective outcome. Follow separate specific guidelines for high-risk occupations. For instance, hospitals, healthcare, and allied workplaces that would be a requirement to cater to their occupational hazards. Workplace category on risk possibilities. We have two levels, and the first being the risk exposure level. We have category 1, which is low, that is minimal occupational contact among workers. We have category 2, that is medium, close contact with general public or co-workers, and we have high risk exposure level, which is close contact with those known or suspected of COVID-19 cases. We also have the precaution level based on the risk exposure, also categorized as low, medium, and high. In low, they're general; in medium, they're enhanced; and high, the extremes. We also have an emphasis on hierarchy of controls. Here we have elimination, that is work from home, use of electronic platforms, for instance, teleconferencing. We have substitution under this category, where we mechanize work wherever feasible. We have engineering control, that is restructured workplace, maybe 2 yards, 6 feet gap between workers. We have floor marking on flow of movements. We have face shields for front desk workers, and we have pre and post work body surface temperature checking. So we have administrative control, which would include maintaining a duty roster as per work necessity, have a supervisor for monitoring, distributed arrival, departure, and lunchtime timings. We have a regular disinfection of common work surface, monitored use of canteens and washrooms, follow strict guidelines for individuals having COVID-19. We can also use e-platforms for meetings and seminars, also online platform for inter and intra-office communications, as well as mass awareness through reorientation training on precautions to be taken for COVID-19 transmission. Going forward, we have personal protective equipment, generally known as PPEs. This include proper face mask is mandatory, gloves, apron, face cover in case of direct contact with the public, use of PPE as advised in government guidelines from time to time, wash and change PPE as appropriate. It is important to remember that robust planning to stage return to the workplace is necessary to contain the spread of COVID-19. Prior to reopening, risk assessment of workplace and all possible hazards for health and safety must be conducted and reviewed. Employers should take preventive and protective measures such as engineering and administrative controls before actual initiation of work. We can therefore have a further read on Beyond COVID-19, Compendium on Return to Workplace Guide, and ICMR NIOH initiative that provides a great level of detail on steps required to create a safe and healthy workspace.